Norman, I can tell you I'm heading off to get my second jab today. I'm getting the AZ, and this is the earliest that I could get it. I'm pretty happy to be getting it, but there are people who still aren't able to access it, and children are what we're really wanting to focus on this morning.
Yeah, so just well done on getting the AZ, and just a reminder to 60-year-olds and above, go and get your AZ, get those rates up to well over 90% in the over 60s. That's really important. Well, there are increasing reports that kids are an issue, and the Doherty modelling suggests that kids are not a problem in terms of transmission, but that's not really playing out in terms of the international data at the moment. So, for example, there's a study of 6,000 households in Ontario with the Alpha variant, not the Delta variant, and they showed that 0 to 3-year-olds were actually quite high transmitters. Now, before we all panic about that, there's a clear explanation for that, but it does show that kids are transmitters. So these were families where the child was the child brought the infection into the household, and they could measure the spread. Is that you cuddle 0 to 3-year-olds. So you're much more likely, anybody with an adolescent who's age 15 and try to cuddle them, forget it. But you do cuddle young kids, so parents do catch it. So that's one explanation for that. But kids are more transmitters. But you're also seeing reports from Arkansas, for example, at the moment, where kids are getting quite sick with it. The kids who are getting quite sick do seem, there's another respiratory virus going around in the United States called respiratory syncytial virus, which also causes a respiratory infection. Some of these kids seem to be getting double viral infections, and that the two together do not bode well. So kids are vulnerable in this situation, and the sooner we can get them vaccinated and get vaccine approval for under 12-year-olds, the better.
In Melbourne, playgrounds are being closed after tougher lockdown restrictions were announced. Is this a good move or overkill?
Well, it's hard to control. It's hard to control playgrounds. There haven't been, as far as I'm aware, there have been no exposure sites no playgrounds nominated as exposure sites. But closing playgrounds is similar to why you close schools. It's not just to stop transmission amongst kids, it's to stop circulation of people in the community. And also, if a young kid falls off a swing, any parent will rush forward to help. They are risky environments, but a lot of it is about just keeping people at home. And it's tough for kids, there's no question about that.
And I guess it's, just trying to stop that socialising as well. I know the playgrounds near where I live, Norman, there's a big bunch of adults standing around watching. It's good news that we are finally seeing the vaccine numbers increase, the number of people who've now had their double dose. Yeah,
so the percentages are going up, and we're getting to, good daily doses being administered. New South Wales is contributing to that. There's high daily doses. But the one thing we've got to watch out for, and it's been shown starkly in New South Wales, is that, and we've talked about it before in the programme, is the averages hide difference. And so in wealthier suburbs, better educated suburbs, and suburbs where English is a first language, you've got high vaccination rates, and you've got much lower vaccination rates in suburbs where English is not the first language and where there's disadvantage. And you're seeing that in Aboriginal communities, and you're seeing it in the southwest corridor of Sydney, and I haven't looked at the data yet, but I'll bet you're seeing it in the northwest corridor of Melbourne. So don't be beguiled by averages. We've actually, disadvantaged populations should be preferentially targeted so that we get those up too.
All right, Norman Swan, thank you.
You're welcome.